Welcome to the Neurology Live Mind Moments podcast. Tune in to hear leaders in neurology sound off on topics that impact your clinical practice. I'm your host, Marco Meglio, editor with Neurology Live. In this episode, we sat down with Dr. Taylor Hess, a multiple sclerosis specialist at the Michigan Institute for Neurological Disorders, who shared insights in recognition of World MS Day held May 30th. Hess spoke on the underrecognized symptoms of multiple sclerosis, the evolving focus of research and treatment, as well as the importance of seamlessly integrating the new MS diagnostic criteria. She also provided commentary on the latest key research priorities, as well as how clinicians should approach tough conversations about MS diagnosis to patients and their families. Let's dive in.
World MS Day is a unifying moment that raises global awareness. To me, it's all about support. It's about supporting the MS community through their care, through their diagnosis, and through their treatment, while also, trying to get advocacy for everybody to have equitable treatment and equitable care across the world. I think that this works out perfectly in conjuncture with CMSC, where we bring all these global thought leaders together to share the latest and greatest MS news and research, and where we can come up with new initiatives to better take care of MS patients.
Yeah, the timing works out very, very well. We're actually heading off to CMSC later on today. So awesome to see the different types of clinicians. Obviously, CMSC is also amazing because there's a lot of different specialists, a lot of different walks of life that come in from the MS community. So it's a great kind of just global initiative, to say the least. So in terms of raising awareness, what aspects of multiple sclerosis do you feel as though are well known? And also, to that same contrasting point, what aspects do you feel as though the public and even the clinical community maybe doesn't fully understand or doesn't have as great of awareness of?
I think the aspects of the disease that are most well known are what we can all see visibly. So meaning you can see motor dysfunction and gait abnormalities. And I think we're, good at witnessing and seeing those. However, I think where we fall short is with symptoms that we can't always see, meaning fatigue, cognitive dysfunction, and emotional well-being. And while we fall short there, I think it's really important that we try to advocate for patients, particularly in those areas, and try to direct research into that area. That way we can better patient care.
Yeah, sometimes the relapses kind of dominate the conversation for patients with MS, but there's a lot of other things going on with these patients as well. So, a big thing right now in the MS community is the introduction of the new diagnostic criteria, which should be published in the next month or so. It's coming up very, very soon. So how important is the effective transition to a new diagnostic criteria going to be over the next couple of months and even the next years? Just talk about this shift from a global perspective.
I think it's really important for a few reasons. So one, I think it's important that we're increasing that diagnostic sensitivity and we're catching these early diagnoses. We already know that one of the most important things about diagnosing MS and treating MS is diagnosing and treating early, meaning trying to get patients on high efficacy disease-modifying therapies early in their disease course. And with the new criteria, it should hopefully help us be able to do this even better than we do right now. I think there will be challenges trying to get the diagnostic criteria out there on a global perspective, right? Because we're also comfortable and used to this 2017 McDonald's criteria. So it's going to be really important to educate providers not only in the country, but around the world of the new diagnostic criteria. That way we can better serve patients and get them, diagnosing them earlier. I think the criteria should help us do that in general based on the criteria, and particularly relating to access. We don't always have access across the world for additional MRIs and time to wait for an additional relapse. So hopefully the new criteria can eliminate the need for additional MRIs and additional relapses to give us that earlier diagnosis. We just have to make sure that we're able to give the proper education. That way patients can get the proper treatment.
We're going to take a quick break from our conversation with Dr. Hess to keep you up to date on the latest developments in neurology. Welcome to the Neurology News Minute. Here's what you may have missed since our last episode. First, on May 16th, the FDA approved Amneal Pharmaceuticals' DHE autoinjector, marketed as Brekia, as a new treatment for patients with acute migraine with or without aura, as well as cluster headache in adults. The therapy contains the same DHE used in hospitals, but in a ready-to-use subcutaneous autoinjector form that can be self-administered. On the same day, the FDA approved Fujirebio's Lumipulse G-p-Tau 217 amyloid beta 142 plasma ratio as the first blood test marketed for the early detection of amyloid plaques associated with Alzheimer's disease in adults aged 55 and older. A study of nearly 500 participants with mild cognitive impairment published in 2025 was one of the main reasons for the decision. And lastly, on May 19th, ApneaMed announced positive top-line data from its Phase 3 Synergy trial assessing AD109, a first-in-class, once-daily oral pill, as a potential treatment for obstructive sleep apnea. Overall, the agent met its primary endpoint, demonstrating a statistically significant reduction in apnea-hypopnea index across a broad range of patients with mild, moderate, and severe OSA. For more information about these stories, head to neurologylive.com, or you can check out the corresponding link in the show notes. And now, back to our conversation with Dr. Hess.
Yeah, like you mentioned, not every place is kind of the same, especially with some of the incorporation of the biomarkers. I'm not sure if we're going to have exact resources and access to all of those, depending on where we are in the country and the world.
Exactly.
Right now. So, also talking on a more global scale, or I guess this is more of just a national scale. You mentioned a little bit about research at the beginning, but where should federal and industry-led funding efforts be directed towards in the next couple of years? Where can we be assisting and, helping out with some of the gaps?
I really think funding should prioritize progressive forms of MS. The medications that we have for relapsing MS are great. They work so well, and we really need to focus more research in terms of progressive forms of the disease. I know we're obviously starting to do that with these BTK inhibitors, which is so exciting, but I hope that we can delve more research into this and really help the progressive MS community. I also think remyelination and repair therapy is a great area that we can focus on in research. And then I think another important factor to mention is symptoms, right? So the symptoms I mentioned earlier, fatigue, cognitive dysfunction, emotional well-being. I think it's important that we also not just do research for disease-modifying therapies, but that we also research ways to make patients have improved quality of life and treat these symptoms.
Well, that kind of leads me to my next question, talking about quality of life. What aspects from a clinical community or what just things can we do to strive to improve the holistic care for patients? And, obviously, like we'd mentioned before, the therapies that we have right now are very, very effective in reducing the relapses. But what else can we be doing from a clinical community side to provide more holistic care for these patients?
I think it's so important to take care of the patient as a whole, right? While we say let's go on a high efficacy therapy, and sure we should, but there's so much more to the patient, right? We need to control all of their other modifiable risk factors. Do they have diabetes? Do they have metabolic syndrome? Can we control some of these symptoms with weight loss and exercise and, a healthy diet such as the Mediterranean diet and making better lifestyle choices? Can we convince patients to, avoid excessive alcohol or quit smoking if they're a smoker? I just think there's so many things that go into patient care and looking at the patient as a whole that you want to make sure that you're addressing each one of these things and not just the MS treatment, but also focusing on the patient.
Yeah, we've definitely started to take a little bit more of an interest into the full lifestyle, the full kind of picture of everything, and, kind of incorporate all of those other factors that go on in their disease progression. I'm also curious from your perspective, Dr. Hess, obviously getting diagnosed with MS or getting diagnosed with any neurological disorder can be a challenge and can be a hard thing to hear for patients and for families themselves. So, what considerations should clinicians take when having discussions with patients and their families about the actual diagnosis of MS, and how do we approach that in the right, proper way?
I think it's really important to be clear, to be empathetic, and to be empowering. MS can be a scary diagnosis, and I think it's so important to remind patients that the MS now is not necessarily the MS from 25 years ago. The treatments have come so far, and the treatments that we have to prevent relapses are so good, and patients can really do so well. And in terms of the progressive forms of the disease, finally, research is really diving into these areas, and I'm hopeful that we'll be able to treat those forms of the disease as well. And then hopefully we can continue to get better at symptomatic care as time goes on. So I think that even though it can be such a scary diagnosis, it's important to know that, we support the community and that we also give them additional resources. I think it's good to remind patients that while you have your clinician, there's also other things like the National MS Society, the Multiple Sclerosis Association of America, Yoga Moves MS. And it's important to use these resources and know that you're not alone and that we're all here to support you.
Thanks for listening to this episode of the Neurology Live Mind Moments podcast. To support the show, be sure to rate, review, and subscribe wherever you listen to podcasts. And as always, for more neurology news and expert-driven content, visit neurologylive.com.